Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
When a baby's first tooth appears, it marks an exciting milestone and an essential moment for parents to step into early oral care. This tiny tooth signals the beginning of lifelong dental health, making it crucial for families to understand how to protect it from the start. Knowing what to do at this stage helps prevent early cavities, supports healthy eating and speech development, and builds strong habits that benefit children for years to come. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we're here to explore an important aspect in every parent's life: what to do when your baby's first tooth arrives. And to guide us through this essential phase of early oral care, we are honored to have with us the esteemed dental expert, Dr. Shalu Verma. Dr. Shalu Verma is a highly respected professor at the Department of Paediatric and Preventive Dentistry of SGT University, Gurugram, renowned for her clinical expertise, academic leadership, deep commitment to child oral health care. With a distinguished career spanning years of service in dentistry, she has earned a reputation not only for her skillful treatment of young patients, but also for her role in shaping the next generation of dental professionals. Her ability to blend compassion with precision makes her one of the most trusted names in pediatric dentistry. At SGT University, Dr. Verma plays a pivotal role in both academic and clinical domains. As a professor, she is known for her engaging teaching methods, clarity of instruction, and unwavering dedication to student learning. She ensures that her students are not only well versed in theoretical knowledge, but also trained in delivering empathetic, child centric care, an approach essential in pediatric dentistry. Her mentorship has guided countless students through the demanding journey of dental education, inspiring many to follow in her footsteps. Dr. Verma's academic interests include preventive dentistry, behavior management for children, and innovative techniques in pediatric dental procedures. MAM has contributed to research and academic publications that reflect her commitment to advancing the field through evidence based practices. Her active involvement in curriculum development and departmental growth has significantly strengthened the pediatric dentistry program at SGT University. In clinical practice, Ma'am is deeply admired for her calm, child friendly demeanor and ability to build trust with even the most anxious young patients. Her approach reflects perfect balance of clinical expertise and nurturing care, ensuring that every child receives safe, effective, and positive dental experiences. Dr. Shalu Verma, TIP Media welcomes you, ma'am.
Welcome. Thank you.
Thank you so much for your time today, ma'am. Ma'am, the arrival of a baby's first tooth, is a very joyful milestone. Yet many parents, they feel unsure about the right steps they need to take. So early care, is very crucial for lifelong dental health. So to help families navigate this stage with confidence, I'd like to begin this discussion with the most fundamental question here: that when do babies usually get their first tooth? And what early signs of teething, should parents look out for?
Okay. The best time for the tooth to erupt into the oral cavity is 6 months. Mostly at the age of 6 months, when the infant is at 6 months of age, the lower central incisors erupt first into the oral cavity. But we
Right.
have seen in some of the cases, instead of lower, upper central incisor erupt. and that
Okay.
shocks everyone. Okay,
Okay.
like this.
Okay.
And
Right.
the teething signs are like that. The child will be little irritable. He or she will be having a pain in their gums. It will irritate that thing, right? For that, the soothing, the child will put his or her finger into the oral cavity and bite it to relieve
Okay.
the pain. Yeah.
Right. Right.
And a lot of drooling will be there. Itching in
Right.
the ears will be there. Always the child will snatch or no his or her ears like that.
Right.
And for that, you there will be most of the time we have heard that kids are having loose motions. So bowel
Right.
upset is always there. So
Right.
it is a part of the teething. So
Right.
parents should not be very much worried about it that the motion is going on. It will
Okay.
heal on its own, right?
Okay.
Yeah,
Right. Right. Like you just mentioned, ma'am, that teething will be a self-limiting condition and probably would resolve on
yeah.
its own. But I'm sure that you just mentioned that the phase is very, very uncomfortable for the child and a
Hmm.
relatively a new experience for a new parent. So, as teething begins, how can parents safely and effectively soothe their baby's discomfort here?
Yeah, it is very important to take care of this period because for that you can what the parents can do they can take a small soft muslin cloth or a gauze piece and they can wrap it around their index finger
Okay.
and they can put that gauze piece in a bowl with the lukewarm water in it and they can clean the teeth as sorry that not the teeth the gum pads and they can
Right.
massage on that that will relieve
Okay.
out the pain.
Okay.
Okay,
Right. Right.
that is the best thing that can be done. Or they can do the teethers are available in the market right now. They can
Okay.
put the teethers in a fridge. It will become cool, and they can
Mm-hmm.
give that to the
Okay.
children to bite on it. That will also help in reducing their pain.
Right.
And if they can also give some of the vegetables like cucumber is there, carrot is there, they can peel that, clean
Mm-hmm.
it, and give to the babies. So they
Okay.
will bite it. They can get the nutrition also with the
Yeah.
juice, and the cleaning and the relieving of pain is also there. Even they can frozen the some of the fruits in a freezer, and they can give a big bite so that they can can't bite it and swallow it. They can only have the juicy effect of that. That is also two things like nutrition as well as
Okay.
the smoothing of the pain.
Right. Right,
That's it.
ma'am. And like you just mentioned that parents can use, a bit of dip gauze piece around the gum pads of the baby. So do we assume that before the first tooth even appears, is it necessary to clean a baby's mouth? And if yes,
Yes.
what is the correct method, ma'am?
Uh, at least twice in a day. This
Okay.
exercise should be performed by the
Right.
parents, right?
Right.
And
Right.
even if they can do this thing even after every one or two breastfeed, that will help for
Okay.
bacterial count to go down. They
Right.
can apply the gauze piece around their finger, dip it
Okay.
in lukewarm water, and gently massage on the upper arch as well as the lower arch. That will
Okay.
help.
Right, right, ma'am. And once the first tooth erupts, how
Hmm.
should parents take care of that very first tooth? A very exciting experience, I must say,
Yeah.
but then it needs to be cleaned, it needs to be taken care of. So, how many times would you suggest that it should be cleaned?
That tiny teeth, two teeth will
Yes.
erupt.
Yeah.
Two tiny teeth will be there in the oral cavity. As soon as the teeth erupt into the oral cavity, then and there the brushing should be started.
Okay. Right.
Yeah.
Right.
In the market, we have finger brushes. They
Right,
have
ma'am.
a small head and a very soft bristles. The
Mm-hmm.
parent can wear that finger brush on their fingers, and with
Right.
that the help, they can give a little stroke and
Right.
clean it. That's it. No,
Right.
don't have to apply any dentifrices, toothpaste, nothing. Simple
Okay.
cleaning with the brush. and the other gum area, they can again clean it with the muslin cloth or a gauze piece.
जी
That's it.
जी ma'am, जी. And now coming on to the feeding habits. Now the tooth has
Mhm.
erupted, and like you just said that we have a pair of teeth just in that small little oral cavity. So what weaning or dietary practices would help protect these newly erupted teeth from early decay?
Okay. The weaning should be introduced at the 6 month of age, not before that.
Okay,
As
right.
soon as the child is 6 months and more, the semi-solid food should be introduced slowly, not a bowl bhar ke. Okay,
Oh,
small
right.
amount. It is
ठीक है.
already mentioned on the that tinted foods level for the
हाँ जी.
infant formula is there. The doses are mentioned over there. The parent should follow that, or they can
Okay.
help take the help from their pediatric
Right.
doctor.
Right.
Okay.
Right. जी.
Then the weaning, it should be introduced at 6 months of age. That
जी.
is the best correct age.
हाँ जी मैम. ओके. और अब थोड़ा सा टूथपेस्ट की एंगल में चलते हैं जहाँ पे पेरेंट्स हमेशा बहुत ऑब्सेस्ड रहते हैं बिकॉज बच्चों के लिए सामान बहुत इंटरेस्टिंग होता है और बहुत कलरफुल और बहुत ब्यूटीफुल प्रोडक्ट्स अवेलेबल होते हैं. सो व्हेन इट कम्स टू टूथपेस्ट, should parents introduce toothpaste at this particular stage? And
No.
if you
Uh,
would, yeah, yeah, please.
not at till the 2 years of age, the toothpaste are not as such recommended. After
Okay,
2 years of age, because the child is not able to spit, they have not learned how to spit. If we
जी.
use a toothpaste, it
हाँ जी.
it will be very harm. It's not they can't do the spitting process, so
जी.
that is not advisable, right?
हाँ जी.
And in the markets, there are some of the toothpaste has been introduced. They are foam free. Like for
Okay.
an example, from Group Pharma, ethosphere करके एक toothpaste आता है. That is
हाँ
very
जी.
good. That can be applied, but
हम्म.
what should be the size? To just a rice size,
अच्छा.
चावल के
ठीक है.
दाने के बराबर. वो आपको
ओके.
ब्रश पे लगाना है, and then you have to spread it. Make a smear layer.
ओके.
Okay, and
हम्म.
you can gently clean each and every tooth and each and every surface of the tooth.
जी.
That
जी.
is important because some
जी.
of the sites are being left, and
हाँ.
there only the food will be stuck in, and the dental caries will come in the old.
ओके.
Okay, after 2 years of age, they can introduce 2 to 3 years. They can use the fluoridated toothpaste, and
ओके.
the size can from right to it increase. That's it.
ओके. ठीक है. तो वो पी साइज का राइस से फिर थोड़ा सा बड़ा साइज वो यूज कर सकते हैं आफ्टर अ कपल ऑफ इयर्स. राइट मैम.
Yeah.
राइट. और अभी जैसे कि आपने बोला कि पेरेंट्स सारे टूथ सर्फेसेस क्लीन करें प्रॉपरली और एल्स डेंटल केरीज हो सकते हैं. सो लुकिंग एट अर्ली ओरल हेल्थ, are there any warning signs of dental issues in infants that parents should watch for?
Okay. There is saying in our pediatric dentist, lift the lip. Lift
अच्छा.
the lip.
ठीक
You
है.
can check the dental caries or anything by lifting the lip, upper lip, and you can
ठीक है.
inspect the teeth present.
हाँ जी.
If there
हाँ जी.
is any white spot surfaces or brown stains are can be seen, then the parent immediately should contact their nearby pediatric dentist to
ओके.
seek the help.
ओके. ठीक है. तो मैम ये आपने बताया अगर उनको कोई प्रॉब्लम दिखती है, बट आई एम श्योर एक पर्टिकुलर एज भी होती होगी जहां पर पेरेंट्स शुड आइडियली टेक देयर किड्स टू अ पीडियाट्रिक डेंटिस्ट. सो एट
Yes.
व्हाट एज should the baby have their first dental checkup, and what can parents expect during this visit?
As soon as the tooth erupt into the oral cavity, that is the right age and time to visit
Okay.
your pediatric dentist nearby.
अच्छा.
Okay,
ठीक है.
so
ठीक.
get the correct guidance
ओके. राइट. राइट.
so
ओके.
that they should know how the caries can be prevented, what type of food we should give the child,
जी.
what is the right brushing technique, what are the toothpaste they should use. Right, every six
जी.
months you should go and have a checkup. This is the
जी.
recommended thing.
हाँ जी, ठीक है मैम. And I'm sure for very curious parents or who always are seeking some guidance or the other, क्योंकि आजकल ना we have a lot of information available on various platforms. So, what would you suggest for such parents? I mean, where can they find reliable, easy to understand information on infant oral health?
This is the best platform. THIP is the best. Healthy
I'm
Indian
sure.
Project is the best platform, I think. They can get the good information and the right information, because
Right.
you people deal with the authentication with that practicing doctors,
जी,
right?
जी मैम.
This is the best platform they can get and the knowledge and upgrade their knowledge and clear their issues.
Ji, ji, ma'am. And I am just going to summarize this wonderful session for new and curious parents by simply asking one final question here that can you help outline the essential steps every parent should take once their baby's first tooth appears, to build a strong foundation for future oral health?
Okay. The thing is that the parents should make the child brush twice daily. This is the best habit because a toothpaste
Okay.
works for 12 hours. So,
Ji,
twice daily is the best recommended sessions they should take for their
ji,
brushing habits. Once
हाँ
this
जी.
habit is there, it's always there, right?
Okay.
And introduction of the non-fluoridated toothpaste before the age of 2 years, and after 2 years or 3 years of age, you can switch to fluoridated toothpaste, recommending
Okay.
upon the dose and the area. Some areas are having high fluoride in their water. Then in
Mm-hmm.
those areas, you should, in those areas also, you should use fluoride toothpaste. That will
ठीक
help
ठीक है.
from protecting the tooth from the oral cavity,
हाँ जी.
from the dental caries, right?
जी.
And this is the thing, 2 times daily. Then the
Mm-hmm.
amount of toothpaste applied, I've
हाँ जी.
already told you. And
Yes, ma'am.
brushing in a circular motion, like Pond's
Oh,
technique. You have to
अच्छा.
go clockwise
हाँ जी.
from the front to the back, and then
हाँ
coming
जी.
anti-clockwise from both the
जी.
side. Then
जी.
up and round and round. This
Okay.
is,
And I think you've just made toothbrushing fun for both the parents and their
yeah.
children. I'm sure कोई गाना भी आ जाएगा for this rhythmic movement. How
And the parent
wonderfully
should
put.
stand behind the child and then
Mm-hmm.
do it. Like
Okay.
at an 11 o'clock position, I can say. That is the
Okay.
best area. And
हाँ
parent
जी.
can peep into the oral cavity and clean the teeth. And
Right.
slowly, they can help the child to learn him or herself.
Mhm. Right.
Like you can introduce 2, 3 colors of toothbrushes. Okay, this
Mm.
is the red color for Monday. This color is for Wednesday. It
Nice.
means the brushing should go like a fun to them. Then they will be
Yes.
very curious and in learning the things,
Yes. And I
and the
think
habit
that's
will develop.
I think it's such a wonderful and a colorful way of developing this habit of toothbrushing, I must say. How beautifully you put everything together. So, on that note, ma'am, I really appreciate your presence with us today. I'm
Thank,
hoping that the enlightening information shared will be valuable to many families out there. So, thank you so much for joining us. It's really been a
thank
pleasure.
you, thank you, thank you.
Thank you, ma'am. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.